You are on mute.
Beg your pardon? Yeah, sorry. Good morning, Dr. Shukla.
Good morning. So you are traveling to your office, you mentioned.
Yeah, I've got to go to work. So, yeah, at 1. And yeah, I'll be back. So I just thought I'll listen through while I'm driving. Yeah.
Right. I think, or there is one, Dr. Payal also mentioned that she won't be joining because of Janmashtami today.
Okay.
And Dr. Shri will be joining with some patients.
Okay.
So that patient agreed for 15-day healing.
No, I spoke to him and I tried again yesterday and said, look, it'll be only a 5 minutes, less than 5 minutes. And the patient said he has too much in his currently and he's going through chemo and all that. I think
Yes.
he wasn't ready to dedicate himself. So I didn't want to push him. Yeah.
But what I suggest is everybody should start writing Shreem, should be the first practice with the patient.
Okay.
So the moment the patient starts writing Shreem, his pain starts reducing because that Bij mantra is primarily having alphabets which improves the cellular reproduction and power to do. Good morning, Sri. And power to do cellular reproduction.
Okay. I mean, writing in the Sanskrit, that's the one you sent us in, isn't it, on the
Yes,
WhatsApp group? Yeah.
yes.
Okay.
But
Cool.
that's very easy in terms of putting things in the Sanskrit preview is because there is a philosophical background attached to it.
Yep, that's right.
If somebody will touch the subject with that emotion only, it will happen phenomenally fast
Yeah.
compared to writing Shreem as SHREEM or
Yeah.
KSHREEM. So
Yeah.
that doesn't serve that purpose. Though it
Yeah.
will work. I don't deny the fact that it won't work. But connecting with the medicine should be taken as prescribed by the doctor. That's the best approach I observe.
Okay. Anyway, I'll try to send him the
That's the
WhatsApp
reason
and see.
I tried so that everyone should start writing. So that writing video will help.
Yep, that's right.
How to write a particular alphabet that will help it better.
Okay. All right
And
then.
today I also shared a document where
Yes.
the
Yeah.
26 diseases which you mentioned. So
Yeah.
now our discussion will happen based on the last sheet which we performed in terms of chakra, element.
Yep. Direction and all that sort of thing. Yeah.
Absolutely. So on the
Okay.
basis of that, I will answer how exactly this total grid is working.
Okay. That'll be great. Yeah.
So since this is generated through ChatGPT, so uh, the basic model errors are there. So I thought ki it's better that I should share the document and put the correction in place.
Okay.
Carol ji,
Hey, good morning, ma'am.
just go there. Carol ji, can you hear me?
Yeah.
Hello? Yeah.
Ji, ji, ji.
So that's Venkat with me on
Okay.
the other screen.
Good morning.
Morning. Hi.
Ji, tell me.
So I have been having disc bulge back pain for
Okay.
a few weeks, and Shri has been helping treat me with Ayurveda. So yeah, she invited me to the session. So
Right. So this pain is located at the lower bottom. Am I audible?
It's charging.
Am I audible?
Yes, I think our internet connection has a problem, but just give me a
That's fine.
minute.
वैसे भी Aarti is taking 5 minutes more to join, so that's perfectly fine.
Oh, okay. So that's Dr. Gaurav. He does the
Yeah.
research part of the mantra healing, and there's
Okay.
Dr. Aarti. She does the healing.
Got it.
So
Okay.
she'll be here soon.
All right.
Take a seat. Yes, so you can continue with the class, and when Dr. Aarti is available, we can do the healing.
Perfectly fine. Perfectly fine. She's just joining in 5 minutes time. Actually, today is Janmashtami, so morning rituals are a little different.
Namaskar.
Good morning, ma'am.
Good. Sorry, a bit late because I was printing
No problems, no problems.
to see what it is.
G. So, Venkatji, it will take 5 minutes max.
No worries.
Meanwhile, I'll continue with my class.
Sure.
Okay. So, you mentioned pain in the lower back.
Yes, I have had the back pain in the lower
Okay, perfect.
back in my L4, between L4 and L5. There's a disc bulge. So that actually pinches the nerve and causes the referral pain all the way down to my left leg.
Right. ठीक है. सो हम सबसे पहला पार्ट इसी इसी चीज को डिस्कस कर सकते हैं अगर सबको लगता है तो. So
Okay.
why I'll just open my slide. So disc pain is every time air element. Wherever there is a pain in our body, it is due to air element by default. Any part of the body, if it is having pain, it is because of air element. Now, air element has northwest direction connected with Saturn with blue color. What else?
Chakra.
Chakra is Vishuddhi Chakra. ठीक है. अब इसके साथ में एक चीज और ऐड कर देते हैं विच इज लिटिल फिंगर. Now, wherever you'll study about the mudras, the mudra which is after my research, thumb is connected with sky. Thumb is connected with sky element. Little finger with air element. Ring finger with fire element. This is middle finger with water element, and index finger with earth element. So that's how the 5 elements are connected. Now, wherever you'll study on internet or somebody who is a mudra specialist, he won't use these as 5 elements. वो स्काई को मतलब फायर थंब को कहते हैं ऑल दैट. सो जब मैंने उसको चेक करा तो देयर वाज अ एम्बिटी. सो आरती इज हियर. मैं क्लास तो बाद में भी कर सकता हूँ. लेट मी कनेक्ट.
नमस्कार।
नमस्कार।
Namaste.
एक सेकंड.
नमस्कार to everyone.
Namaskar.
G. Who's the patient?
वेंकट. Yes.
That's me. Hi. So I'll just repeat what my pain is. So I have a lower back pain. I have a disc bulge in my between my L4 and L5,
Okay.
and that pinches my nerve all the way to the left leg, and so the whole leg pains. So Shri has been treating me for the past 2 weeks or so. So yeah.
Pain, you observe on the left side of the leg or back of the leg, or it's going internally.
It's left side of the leg.
Okay, left side of the left leg, right. Now
Yes.
place a healing request, and it's going up till knee level or ankle level.
No, it goes up to calf level.
Calf level. Okay.
Yes.
Okay. Right.
So I have to tell you that I also got a cortisone injection done,
Okay.
and the pain is much reduced, but my back is still quite stiff and I can't bend or anything. So
Okay. Now place a healing request stating my name is so and so. Please heal me for my backache.
my name is Venkat. Um,
Back and leg
Venkat
ache.
Krishnan. Yeah,
Yes.
Venkat Krishnan. Please heal me for my back and leg ache.
Venkatji, you need to breathe till your navel. What like the way we are breathing, it's okay, but every breath should go till navel, right? It should be very, very smooth
Okay.
without any tax to your body. And with closed eyes, you just observe this thing and keep your observation and the energy flow towards your back and wherever you are feeling pain right now. Are you feeling pain right now or stiffness? Right
Not not right now. I've just had a session with Shri, so not right now.
But there is no stiffness, not at all, not even a like 2-5.
No, there is because I can't still bend. So there is some
Okay.
stiffness, yes.
I'll
Yeah.
ask you after 2 minutes of time, how much is the relaxation? Just be aware of your stiffness, pain, or whatever.
Mm-hmm.
Right. Okay, with closed eyes. Yes, sir. Done.
Okay.
Feel yourself.
Yeah. Okay.
How much is the reduction in your stiffness?
I feel a little bit more relaxed. Yes. Yeah.
If you can put this little bit in terms of percentage.
Maybe about 10%.
Okay, right. So,
बेंडिंग के लिए एक और हीलिंग रिक्वेस्ट लेके फिर से
okay. Give me one more request for flawlessly bending your this.
My back. Okay.
Yes.
So, hi, my name is Venkat Krishnan. Can you please help me
Help me.
flawlessly bend?
With closed eyes, feel the breath till navel and the energy flow towards your impacted area, right?
Yes. Bend my back. Yes.
जी व्यंकट जी डन आप इससे पहले कुछ बोले आई जस्ट वांट टू शेयर वन थिंग विथ यू द एनर्जी व्हिच आई हैव सेंट यू is capable of healing you till 100%, but how you have absorbed inside your body, how much information you are having regarding this pathy. So just be aware of this. This is the only thing which I wanted to share with you. And now tell me, how much is the relaxation?
Bear with me. I'll just stand up and check. Okay. But
Sure,
I'm
sure.
actually feeling a warmth in my back, which I wasn't feeling before. So,
Okay.
wow. So I'm actually feeling like 80% better. I'm nearly able to touch my toes. So, no, this is fantastic.
Yeah, because this is a pathy which maybe everybody is not aware of. And, in this, we can heal a person to 100%. But again, there are reservations how a person can heal while sitting so far from me, and that too up till 100%. Maybe there are so many reservation of the body, right? Now, okay, thank you so very much. And I'm handing over to Dr. Shukla. Thank you.
Thank you. Thanks for your healing.
Thank you.
जी Venkat ji. So you have seen today a live miracle because I am sitting in Meerut, 60 kilometers from Delhi, and you are
Hmm.
there in Australia. Something which we triggered from here, getting connected to you. So I believe the speed and the distance are phenomenal in this pathy. We took hardly 2 minutes of time. We can share even the live bites ki how much time exactly from here to there making all the corrections and sharing those connections to us in terms of your responses. तो वो 2-4 मिनट के अंदर सब कुछ हुआ. So it's a traditional wisdom practice which was earlier performed by all the Vedyas of our country, but now it's a lost science. So we are connecting in terms of these lost science practices globally. So
No, this is very fantastic. Thank you so much.
now the only thing in terms of do's and don'ts which you have to, मतलब हमने एक बार एक चीज को करके दिखा दिया, the quantity of medicine and time, because यहाँ पर जो पार्ट हम हाईलाइट कर रहे हैं कि when somebody is taking या और used cortisol, तो that's a steroid. तो steroid के अपने साइड इफेक्ट्स भी होंगे. हमने यहाँ पर ना तो आपको टच करा, ना कुछ खाने को दिया, ना कोई आपसे एक्सरसाइज कराई, ना कोई पॉइंट आपका प्रेस करा, आपको कोई मंत्र चैंटिंग भी नहीं कराया, हमने भी कोई मंत्र चैंटिंग नहीं करा. सो हम लोग एक डॉक्टर श्री विल शेयर अ मंत्र विद यू. यू हैव टू राइट इट डेली विद अ रेड पेन. दैट्स इट.
Okay.
That's the
Okay.
only thing. Please write as much as you can so that not only this thing reverses in time, but this will also impact what all are going to be future diseases. Because आप जब cortisol लेते हो तो उससे जो है वो स्टेरॉइड का जो प्रोसेस है उसमें फर्क आता है, और वो कौन कौन से बॉडी पार्ट्स को इफेक्ट करता है, दैट इज ऑल्सो. तो आई बिलीव यू मस्ट हैव रिसर्च्ड ऑल दैट बिफोर टेकिंग इट. तो आपको सिर्फ अपना रोज का थोड़ा सा टाइम देना है और ये बीज मंत्र को लिखना है. जब आप उसको लिखना शुरू करेंगे और इसके बाद जब जितनी भी आप आयुर्वेदा थेरेपी लेंगे उसका जो टाइम होगा विल बी मच फास्टर.
Okay. All
एयर
right.
एलिमेंट, अभी जैसे मैं बोल रहा था, एयर एलिमेंट है स्किन के ऊपर जो है वो शुरू होता है. स्किन में 7 लेयर्स होती हैं और उसके बाद वो पेन जो है फिल्टर आउट होता हुआ, इट इज लाइक कि जैसे ऊपर से कोई टॉक्सिन गिरा और वो अर्थ में धीरे धीरे नीचे उतर रहा है. सो स्काई, एयर, फायर, वाटर, अर्थ, ऐसे करके वो धीरे धीरे पेन जाके हमारे एक पॉइंट के ऊपर प्रेस करता है. तो आपको सिर्फ इस बात के ऊपर ध्यान रखना है कि द मोमेंट you observed pain the first time, that means you already had a toxic thought.
Right.
हमने
Okay.
सिर्फ यहाँ से बैठ के आपका थॉट का क्लीनिंग करा है,
Okay.
सिर्फ थॉट का क्लीनिंग करा है. And by cleaning a particular thought, we see that the symptoms of a disease start reducing. Now, how much time the comfort will continue in one healing is a different part altogether. But the point which I'm trying to highlight is, जब आप एयर एलिमेंट के साथ फायर एलिमेंट के लिए ऑयल्स होते हैं, सो जब आप ऑयल्स और उससे रिलेटेड जो भी मसाज वगैरह ऑब्जर्व करते हैं, जैसा कि आयुर्वेदा में पूरा प्रोसेस है करने के तौर पे, सो द रिएक्शन टाइम्स गेट्स फास्टर एंड फास्टर एवरी टाइम.
Got it. Okay. Nice.
Okay ji.
No, thank you.
Right
This is
ji.
very
Yes,
powerful.
sir.
Thank you.
Thank you so
Thanks.
very much. Right. Thank you.
See ya.
Right, Shri ma'am. Thank you so very much.
Thank you, Gaurav.
जी ma'am.
I'll just be back in some
हाँ,
time.
perfectly fine. Take your time. So, हम लोग अपनी क्लास पे आते हैं वापस. सो अब जैसे हम लोग एज पर आयुर्वेदा फ्रेटर्निटी प्रोसेस, हमारे को 2 चीजें बहुत जरूरी करनी चाहिए. एलोपैथी वर्सेस आयुर्वेद. डिजीज नेम, actions in allopathy, actions in Ayurveda, and comparison. मैं मेरा पॉइंट समझा पा रहा हूं? So what I'm trying to highlight here is any disease for which a patient comes to you, please use Google or any chatbot and ask for specific activities which are performed in the allopathy process and the Ayurveda process. Ayurveda process, the only thing which is not in support is there are no solid researches which are supporting any endorsement. But when it comes to allopathy, there are solid researches. अगर जैसे आप cortisol के तौर पे देखेंगे कि पेन के लिए जो है हमने जो ये स्लिप डिस्क वाले पेन के लिए करा, तो स्लिप डिस्क के पेन के लिए कॉर्टिकोसोल इंजेक्शन लगता है। वो कहाँ पर लगता है, कौन सी वेन में लगता है, वो स्टेरॉयड है। स्टेरॉयड के बाद जब आप उस स्टेरॉयड का नाम गूगल पर डालेंगे तो आपको उससे रिलेटेड रिसर्च पेपर मिलेगा। उस रिसर्च पेपर के अंदर जो है कॉर्टिकोसोल को यूज करने से उसके क्या साइड इफेक्ट्स हैं, आपको उसके बारे में पता चलेगा। साइड इफेक्ट्स कितने टाइम के बाद अकर होना शुरू होते हैं, आपको इसके बारे में पता चलेगा। सो दैट्स हाउ यू विल बी एबल टू एजुकेट योर पेशेंट कि आप जब आयुर्वेदा यूज करते हैं और जब एलोपैथिक ट्रीटमेंट यूज करते हैं उसके प्लस और माइनस क्या है। एज अ प्रोसेस वी आर नॉट स्पीकिंग लाइक दिस विद द पेशेंट। मैं इसलिए बोल सकता हूँ कि मुझे पता है, मैं तो 2 मिनट में आराम लाकर भी दिखा दूंगा और ये भी दिखा सकता हूँ कि भाई कॉर्टिकोसोल के तौर पे आपको फ्यूचर साइड इफेक्ट्स कितने होंगे। बट इसी पार्ट को हम सभी आयुर्वेदा प्रैक्टिशनर्स के साथ वी आर ट्राइंग टू कनेक्ट, बिकॉज इफ यू वोंट स्पीक about the subject in the format, it won't function. The first and foremost part is understanding the disease and understanding how exactly the protocols work using Dev Vipassana Chikitsa, Yukti Vipassana Chikitsa, and Sattva Veda Chikitsa. Normally, there are multiple misnomers. For example, the patient could have assumed कि she requested me so that I can bend. The bend was not happening earlier. When you place the request for bending, it started happening. Now, the thought which is obstructing bending was corrected, and that's a live demonstration. So, we were able to identify how many points which are there in our brain for a particular emotion. The moment our energy levels raised, instantly we have results. So, now connecting with the 5 elements. So now connecting with the 5 elements, so pain is connected with air element, connected with Saturn, blue color, northwest direction, Vishuddhi Chakra, little finger, air element. Now, why we have these many cases in Australia only? Because air element is connected with sky. So, an easy demonstration for everyone. This is the open space between my two hands is sky element. How will be defining sky? The open space between my two hands. The open space between my two hands is sky element. When I put my hands like this, I observe that there is something moving between my hands. That is air element. Fine. Up, you all can do this. So this is air element. Now, if I'll start doing it like this, whatever was part of part I was holding between my two hands, there is a friction between that, and as a result, fire emerges. If I'll keep on rubbing my hands for a faster duration and for a longer time period, I'll observe that there is a drops of sweat happening here. This is water. And when I when I hold that water for a longer period, the entire drops will get solidify and I will get mel on my hand or palm, and which is the earth element. So sky, air, fire, water, earth happened here only. Am I able to express myself? And are you listening?
Yes.
Yes, yes.
Perfect. So when we see that air element is causing pain in Australia in the domain of sky, we have ozone depletion with us. So as a result, when I say the air between my two hands, it is actually something as a gap between 7 layers of sky also. So there are layers associated. So as a result, when one layer is broken, the layer above and the layer below, the ion exchange or the particle exchange takes place. As a result of that exchange in particles, we observe that whatever is coming to our skin is getting altered because of that change in particle system. So we'll come later how we can reverse even that part. But if you'll see in terms of remedy, I took a simple shortcut. Everything is impacting my thoughts. Everything is impacting my thoughts. So when I say I have to make a change, so I have two options. A, I have to make a change or repair the ozone system. So if I'll correct the ozone layer of the whole of Australia, I need few practices, at least after 1 year time of learning healing, I can minimize the ozone layer depletion happening in Australia. But who will do that? People living in Australia should start writing Shreem. The moment they start writing Shreem, there are alphabets attached to it. A, B, C, D, E. Okay, so now I put a question with Anne and Dr. Shobha. Which is the most important body part or function? Most important. Nothing can be the more important that part.
The digestion,
Most important. If you put the order to it,
the thought. Without coming thought, you even can't eat. Yes.
you are close, but
Right.
not actually. It's the right answer. And any guesses for it?
Your breath.
Breath, yes.
Okay, but breath is not the right answer.
Okay.
Atma,
I thought it was the gut and the breath here.
Okay, so now I can say the most important function of our body without which we cannot survive is cellular reproduction.
Yeah.
Is something more important than this? Now, for breath, you should have lungs. For lungs, you should have cellular reproduction. So there is a human journey which happens like a sperm, then sperm got to zygote, from zygote to 100 trillion cells plus. So if this doesn't takes place, will there be any function possible for the body? So Ayurveda starts from this. Now the two alphabets, Sanskrit alphabets which are associated with it is Shatkonka Sha and Kshatriyavala Ksha. This is connected with cellular reproduction and this is connected with power to do cellular reproduction. So this is function and this provides energy. So that's the reason I have combined the two. Am I able to express myself?
Yep. Yes.
This is water element. So as a result, when we start writing stream in this format, the water element creates navras in our body. So the structure with 9 elements, 9 parts we have discussed also bear a navras. So navras is also explained in our text. So we can map each ras for each of the element, chakra, direction, all that part. Now what happens in the entire activity is a particular ras gets dried up because of disturbance of the air element. Let's suppose I have to speak. My throat utters the word, but my throat utters the word because around the tongue there is a saliva, one form of the ras. Now, because of issues in my neck, throat chakra, air element, I observe that a particular ras got dried up because the property of air is drying up. You put clothes outside after washing, they gets dried up after the entire activity. Am I able to express myself? So why there are so many problems happening there is because the air element is getting toxicated because of change in the layers in the sky region. So the moment I counter that part, instantly after writing Shreem, lifting all those energy in the entire approach, we actually correct the process by distribution of navras within our process. Then the fourth one is E, which is fire element energy. So energy water balance, energy fire balance. What I'm saying, water and fire balance. So E is fire, R is water. So after generation of navras, we have fire and water balancing. Fire has the property only to go up. Water has the property only to go down. Now this prana activity has to balance between fire and water. Water has to create different ras. For example, the same ras when goes to my knee joints, my elbows, my ankles. There, if a particular rus is missing, it creates that. The moment it creates that part, immediately the energy body also has to balance. So now from the sunlight, these 7 layers are actually filtering my air element before it touches the earth. So because whatever scientific developments took place in Australia, as a result, we have a deep hole in the sky, which is causing the depletion of ozone layer. And thus we are not able to see what is causing the difference. So when I check, the impact is only on the human body, and human body can be repaired if they start writing Shreem, or if they start performing Havan with. So Havan is also one part of Dev Vipassana Chikitsa. So if they are start performing Havan with Shreem, it will also repair the environment, the 5 elements missing. So now we can say कि as per Dev Vipassana Chikitsa, Yukti Vipassana Chikitsa, and Sattva Vajaya Chikitsa, the first thing we need to repair is thought. The second thing, how many times and for how long. Quantity and duration. So I normally say कि quantity is 3000 times daily and duration is 1 year. That makes the total deepest repairment. ये मेरा quantity है, and I don't say कि everybody should do it. But what I'm trying to suggest is, as a domain described in a lost science, it is primarily connected with what all elements. मतलब, I've never seen anybody talking about Yukti Vipassana Chikitsa in this format itself. But if we identify that Dev is Atma and taking refuge of that Atma, now we can identify the 16 elements. So first element we shared was chakra, navagrah, direction, color, finger, all this integration. The second part was, एक second. The second part which connected was mudra. So for mudra, we need to focus on little finger. Now, a simple activity to observe. This is connected with, the thumb is connected with the head region. The 2 middle fingers are connected with our feet. And the 2 side fingers are 2 hands. So that's my human body in my both hands. So from thumb to this part, so between these 2 fingers, I can identify my Mooladhara chakra. So likewise, I can point all the 9 chakras within my system. So I've already shared the chakras. Now, in terms of air element, the air element happens in little finger. So I need to observe at what point I am, after pressing this finger, I can observe where is the pain. If somebody is saying lower back, तो वो lower back region यहाँ पर हो गया, तो यहाँ से यहाँ के बीच में कोई point ऐसा होगा जहाँ पर pain होगा. So that all that is covered in the Mudra Vigyan. third part.
Does it change with the right and left hand?
No, it will be same. It is purely the if I can say, जैसे in terms of वास्तु या human, मतलब we say ना अर्धनारीश्वर concept. So half male, half female. So half male, half female doesn't denotes that there is a masculine or feminine identity. It is primarily denoting what all energies are affecting my body. For example, if Vastu Purush from head to tail, right side is impacting, that part will be impacting the males of that house. When it is the left part which is getting impacted, that will impact the female of the house. So likewise, in my hand, the moment there is right side from head to toe getting impacted. So for example, if I said ki the pain is between this finger and this region, from here to there. So when I observe the pain here, it is occurring towards my right side. When I see on my left side, is it occurring on the same side or different side? So by identifying those points of pain, I can actually check that is the person who is putting the request for healing or any Ayurveda therapy, actually, is there any gap here? Sometimes the gap is into the brain. He feels that there is a pain, but actual physical pain, there is nothing of that sort. So in that situation, the mental health can be verified ki whether it is paining here after pressing or not, or it is just pure and simple anxiety which is impacting the patient. So if it is pure and simple anxiety, the pain should first occur here, because this part, the first lobe of our thumb, is having the whole body integrated into our brain. So likewise, all that which needs research on this subject falls under the category of Mudra Vigyan. The third part is mantra writing. So which I've already shared, you need to...
About the third-party writing mantra. It is a philosophy or a set of guidelines for writers that encourages them to...
So that's the reason I requested, let everybody start. We should make a practice in Australia that every Ayurveda practitioner first suggests the patient to start writing Shreem with red pen. The moment he starts, whether he starts with writing 9 times daily or 108 times daily or 3000 times, that doesn't matter. That doesn't matter at all. What matters is when they'll start writing Shreem, this process is also going to impact their anxiety levels, their efficiency, day-to-day efficiency of work. So moving forward, the fourth is understanding the domain of universal consciousness. So universal consciousness. Fifth is Mahavidyas. Now Mahavidyas are they're in the Hindu traditional wisdom practices, but that's a part of Tantra and mostly wrongly interpreted. In my recent workshop, when I was studying about Kamala Mahavidya, now Kamala Mahavidya, as per my research system, is connected with the lymphatic system. So now what is lymphatic system doing? Lymphatic system is improving my immunity, correcting my energy levels, improvising my excretory system, improvising my reproductive organs, cleaning the entire body. So cleaning and energizing is happening from the lymph nodes. And above that, it is also giving me, in terms of Navras, what is depleted in the process. Now, if somebody is practicing Kamala Mahavidya, it is wrongly interpreted as only worshipping Lakshmi. It was a technical document connected with the lymphatic system of my body. The moment I also shared the syllabus for MBBS, MD, DM on lymphatic system. If you have seen the group, I shared that detail. So all that which gets covered, and lymphatic system is something which the allopathy fraternity doesn't know at all. How exactly a lymph node is acting. They suddenly suggest lymphoma is something which needs to be recommended to a patient, or lymphoma ke baad all that into the surgery process. But we need to do research on our subject. Am I able to express myself?
Yes.
So Shubha ma'am, today there is a request ki we should
Yeah.
not extend after 9. So
Mhm.
what we'll do is ki we'll stop here, take there if there are any questions, so that in the second part, in the 3 to 4 p.m. class, we'll be better able to complete this part for pain. Now, when I say pain, the entire 26 disease spectrum which all of you shared with me, there you'll find connected with multiple domains. Whatever we are discussing will impact all those diseases. Okay, so since it's already 9 now, hardly 2-3 minutes, so we'll cover this part, Mahavidyas, because Mahavidya's expression of that Mahavidya part is a time-taking process. Somebody in our, through our religion, they they have put secretly the entire scientific functioning of human body, cosmology. So when I researched this subject, I thought, Arey, this is nothing to do with puja. There are different weird kind of deities. Matlab, if you'll say Kali is not wearing anything with hair open. It was nothing to do with that female. The entire science was in terms of understanding what is the domain of time within my body. Now time is connected with Lambikagra Chakra. So time is also controlling my Atma. So there was so much to unwind in that entire process. And because it was considered to be an object of religion, people, the negative people even misuse the subject. But the misuse was not possible. So when I checked my entire subjects for last 14 years, it took me almost more than 14 years to correlate the entire subject, understand what is the Sanskrit code for it, how that code got originated. So I realized there is a vast amount of information. If I start putting my intentions on that, I can decode possibly all the diseases. So I started my research in terms of putting things into a format so that anybody can heal. ABCD करके वो आता था ना, anybody can dance. So I'm saying anybody can heal. And I've tried, tested on multiple people, even with people who doesn't have any background in spirituality. All 19, 20, 21 year of age, boys and girls from IIT Mandi. We trained them for 1 year. We trained them for 1 week, 2 hours daily. and they were able to heal anyone in 2 minutes of time. And the entire recordings are available with us. The entire scientific report. Are they able to heal the person within 2 minutes of time? There was a brainwave process which we observed. So what I'm trying to say is this subject has a deeper meaning, but we have restricted the approach. So in the 3 to 4 p.m. class, we'll cover the rest part. And from pain, we'll address what all elements, where all we need to observe, what all changes are happening. But the first thing which we can say today as a conclusion is that we should start writing stream. And Dr. Shri is my brand ambassador for it. ठीक है जी, so let's take a break and connect again at 3 to 4. If there are any patients, just let me know. Share me a message and we can organize independent Zoom calls for even patients alone. If the patient wants to come from 3 to 4 period, it's fine. If they want a dedicated space where their confidentiality is not compromised between doctors, so the best thing is we'll do one-to-one. So we are open for it. So from 8 a.m. in the morning to 10 p.m. Indian Standard Time, we are helping people residing in different countries. So we are very open for it. Please let us know.